This video will guide you through what to expect before, during, and after a laparoscopy cholecystectomy, a procedure to remove the gallbladder.
A cholecystectomy is the surgical procedure to remove your gallbladder. It's preferred over traditional surgery because it's less invasive. The surgeon makes small incisions in your abdomen and inserts a laparoscope tube with a camera. This gives them a clear view of the area they need to operate on. In the following slides, we'll discover the anatomy of the gallbladder, understand the causes of cholecystitis, explore the benefits and risks of surgery, navigate the perioperative journey, learn operation recovery. Your gallbladder is a small pearl-shaped organ located under your liver that stores and releases bile. Bile is the fluid your liver produces that helps digest fats in the food you eat. Your gallbladder is located in the upper right part of your abdomen. Belly, it sits just under your liver. Symptoms of gallbladder problems vary. Some people don't feel gallstones or even know they have them. But if gallstones block the flow of bile, they can affect your gallbladder or pancreas. You may experience the following symptoms: upper right abdominal pain, upper mid-abdominal pain, upper right abdominal pain radiating to the right shoulder or back, pain after eating a fatty meal, jaundice, yellowing of your skin and whites of your eyes, nausea and vomiting, fever, chills, light brown pee or light-colored poop. Normal versus inflamed. What are common issues that affect the gallbladder? Several conditions can cause problems in your gallbladder. The most common condition is gallstones. Gallstones are typically harmless, but can sometimes lead to disease states. Gallbladder diseases include gallstones. Gallstones are pebble-like objects made of bile material that develop in the gallbladder or bile ducts. They can be as tiny as grains of sand to as large as golf balls. They're usually harmless but can cause pain, nausea, or inflammation. Cholecystitis. Cholecystitis is inflammation of your gallbladder. It can occur when a gallstone blocks bile from exiting your gallbladder. Cholecystitis causes fever and pain and usually requires surgery. Gallstone pancreatitis. Gallstone pancreatitis is inflammation of your pancreas. It occurs when a gallstone travels down the common bile duct and blocks the pancreatic duct at a common point just before draining into the small intestine. Gallbladder cancer. Gallbladder cancer is rare. You might feel pain in the right upper quadrant of the abdomen, but it is far more likely for this pain to occur due to another condition. Removing the gallbladder is the most effective way to relieve these symptoms and prevent them from coming back. Are there any alternatives? There is no reliable medication to remove gallstones. Treatments like pain relief and antibiotics can help during sudden attacks, and some people may not have further problems. However, most patients experience repeated episodes. If you have had pancreatitis caused by gallstones, surgery is strongly recommended to prevent serious recurrence. What are the risks? All operations carry some risk, including those related to anesthesia. For gallbladder surgery, complications occur in about 5 out of 100 cases and are usually minor and treatable. A rare but serious complication is injury to the main bile duct, about 1 in 200 cases, which may need repair during or after surgery. Other possible risks include bleeding, infection, damage to nearby organs, retained stones in the bile duct, hernia at the incision sites. Your surgical team will explain these risks in detail before you give consent. Please feel free to ask any questions at any time. Before your surgery, pre-assessment, please attend your pre-assessment clinic, where a nurse will review your medical and anesthetic history and arrange any tests needed. You'll be guided through what to expect before and after surgery. Please bring your medications with you. Admission to hospital. When you arrive, please check in at admissions. A nurse will confirm your details, give you an ID band, and ensure everything is ready. You may also be fitted with compression stockings to help prevent blood clots. Who you'll see. Your surgeon will explain the operation and ask for your consent. Your anesthetist will discuss your anesthetic. Your ODP will support the anesthetist and care for you during your time in theater. You will be asked not to eat or drink for 6 hours before your operation. Please shower beforehand and avoid bringing valuables. You may be asked the same questions more than once. This is to keep you safe. Going to theater and anesthetic. You will be taken to theater either walking or on a trolley. Your ODP will welcome you and stay with you throughout. In the anesthetic room, the anesthetist and ODP will monitor you closely and give medication through a drip to gently send you to sleep. After surgery, recovery. You will wake up in the recovery area, where a recovery nurse or ODP will look after you and monitor you closely. You may have oxygen and a drip. Once you are stable, you will return to the ward. Pain and recovery. Some discomfort is normal, but please let staff know if you are in pain so we can help manage it. Gentle movement will be encouraged to support your recovery. Eating and drinking. After keyhole surgery, you may be able to eat and drink the same day. After open surgery, this will depend on how you feel. Wound care. Please keep your wound clean and dry. You may shower after 48 hours. Stitches may dissolve on their own or be removed after 10-14 days. Going home. Keyhole surgery. You may go home the same day. Open surgery. You may stay a few days. Final advice. Please don't hesitate to ask your healthcare team, including your ODP, if you have any questions. We are here to support you throughout your journey.